Roy Williams. Thank you very much for joining us again for our briefing as we continue to update you with what is happening in St. Kitts and Nevis in relation to the management of the COVID-19 pandemic. I want to recognize among us the Honorable Wendy Phipps, the co-chair of the National Disaster Mitigation Council. Today, I first would invite to give us a presentation Dr. Cameron Wilkinson, who is the Medical Chief of Staff at the Joseph N. France General Hospital.
Thank you, Lesroy. Good evening. In late December, we shared publicly our optimism in our fight against COVID-19, despite the fact that we were in the throngs of our fourth wave. We said then, with the high immunity threshold from the vaccinated adults in the Federation of St. Kitts and Nevis, coupled with immunity acquired by some from previous infections, that it was highly unlikely that our hospitalizations and deaths would ever reach the levels seen in previous waves. Deep into our fourth wave, recoveries now consistently outpace new infections, and we are seeing a precipitous drop in our active cases. We climbed from 23 active cases on December 23rd to a high of 1,360 cases by January 14, and we are now down to 553 as was reported yesterday, and I expect that figure to further fall when the figures come in this evening. Hospitalizations from COVID in the Federation are down, and those hospitalized are stable. All the departments at the hospital previously affected with sick-outs from COVID are back to normal functioning, as most staff members have recovered and are back out to work. Consequently, our healthcare system has not been overwhelmed thus far. Now we remain cautiously optimistic as we approach the second year anniversary of the COVID-19 pandemic in March, that we will finally all be relieved of the stranglehold that the virus has had on every aspect of our lives, as Omicron is fast becoming a game changer. 2 months after Omicron started to spread uninhibited across the globe to become the dominant strain, we have learned, 1, that this variant is highly transmissible, 2, it presents less severe disease and a lower risk of death, and 3, this strain is also associated with a 66 to 80% reduction in the risk of hospitalization, especially in populations with a high vaccination threshold. Therefore, the level of concern we had compared to other strains is lessened. Nonetheless, we must still remain vigilant because Omicron, with its high level of transmissibility, may eventually infect us all, knowingly or unknowingly, and still has the capacity to overwhelm health systems and kill the unprotected and the vulnerable. We have been spared the worst thus far, and are fortunate in a way to have had the Omicron become the dominant strain ahead of the arrival of the more deadly Delta variant in our community. So where are we now? The vaccinated may continue to get breakthrough infections and will most likely recover, which we have been seeing happening here, with little or no problems, but will have an extra level of immunity. The unvaccinated continue to be at greater risk of severe disease, hospitalization, and death, and those at the extremes of age with pre-existing conditions will remain most vulnerable. We have over the last 3 days added a total of 5 deaths from COVID, most elderly, all unvaccinated with pre-existing conditions. This overemphasizes the need for us to be our brother's keeper. We continue to encourage all to get vaccinated to protect themselves and those around them. If you choose not to get vaccinated and get infected, you remain at a significant risk of having severe disease and dying from COVID-19. If you do survive, you remain at higher risk of getting reinfected and still at risk of having severe disease and dying from COVID-19. The stark reality is that COVID-19 will continue to have a presence in our communities, but one that we should not allow to disrupt all of our everyday lives, as was the case in the earlier months of this pandemic. Its presence also does not have to be a death sentence for anyone. We have the tools to change that individually and collectively. So what is the way forward? The way forward now depends even more so on the individual choices we make rather than the imposition of restrictions on gatherings, curfews, and lockdowns by governments. We must remember, however, that the individual choices we make affect others. As governments across the globe begin to retract the imposition of strict COVID-19 protocols to control viral spread and place more responsibility in the hands of the individual should know that they are responsible for wearing a mask in public and frequently sanitizing their hands, for being responsible for limiting their exposure when they go out in mass gatherings by keeping a safe distance from others, and they should be encouraged to get vaccinated and boosted as indicated. We should now start to pivot to a near free movement of people internally. The rest of the world will be preparing for an opening, and we should be preparing for that opening too. With the current trajectory of our increasing recoveries and decreasing number of positive cases, we should be out of this wave by early February. We have fought a good fight over the last 2 years with significant success. Over the 2 years, we have successfully contained the virus. We have limited hospitalizations and death. We launched a successful vaccination program and had an unprecedented high adult coverage of 82% with 1 shot and 76.4% fully vaccinated. We have had successful events in the middle of the pandemic, general elections, CPL, Carnival, Under 19 Cricket World Cup. We reopened our churches and schools, and we started the manufacturing, hotel and tourism industry. It is time for us to continue moving forward. The best way moving forward is having the best protection through vaccination and having our immune systems boosted once we qualify for the booster. This is the best route to the near-free movement of people and mass gatherings we had in the pre-pandemic era. Therefore, everyone who can be vaccinated need to make that choice of going to the clinics to get the protection needed so that we can get back to a sense of normalcy. I make this appeal to all of our adults and to all those in charge of our children between the ages of 12 and 17 who still remain a significantly under-vaccinated group. Those who choose not to be vaccinated will have to accept the consequences of their decisions. It is my hope, however, that we all make the only logical choice based on scientific evidence and fact, and that is to get vaccinated to be protected. Thank you.
Thank you, Dr. Wilkinson. We now invite our Chief Medical Officer, Dr. Hazel Laws, to give us the Health Emergency Operating Committee situation report.
Thank you, Lesroy, and a warm good afternoon to everyone. This afternoon, I am going to share the situation report, but I'm also going to share some color and some beauty. A picture of some flowers I took on Sunday, so I'm going to share some pictures from my collection today. The COVID-19 pandemic has adversely impacted the Federation. However, its beauty remains. St. Kitts and Nevis remains naturally beautiful. That's a lovely picture of the Nevis Peak in the background. Now, in terms of our COVID-19 vaccination program, we rolled out this program 11 months ago. In 11 months, we've achieved the following coverage rates. 82% of the adults in our population have received the first dose. 76.4% of the adults in the population are fully vaccinated. To date, 8.1% of the adults have come forward and accessed the booster shot. In terms of our 12 to 17-year-olds, 17.8% have come forward and received the first dose. 15.3% are fully vaccinated. Now, in terms of the booster shot, there is a change that I wanted to bring to your attention. Now, currently, if you have received the second dose of the primary series 5 months ago, you can easily come into any of the health centers and request the booster shot. So again, if 5 months has elapsed between the second dose of the primary series and the present, you can come in and ask for the booster shot. 55% of our total population is now fully vaccinated, and so we still have work to do. We still have 45% of the population to bring on board in terms of being fully vaccinated. This slide shows the data disaggregated by island. So as you can see, 67.1% of the adults in Nevis are fully vaccinated, and 13% of the 12 to 17-year-olds are fully vaccinated, as compared to 16.1% of the teenagers in St. Kitts and 80% of the adults in St. Kitts. Now, this slide shows or highlights the fact that we continue the trend of recoveries. Many of the cases diagnosed with COVID are recovering, and we are happy that this trend continues. Between January 18 to January the 25th, we've had 936 persons recovering, and in this same time period, we've only added 305 newly diagnosed cases. And so the number of persons recovering far outstrips the number of newly diagnosed. Now this slide shows the fourth wave. We can say that this wave started around about Christmas Eve to present, and this graph is showing that we peaked round about the 4th to the 12th of January, and the numbers are going down. In terms of the recoveries, the line in red shows that we peaked round about the 20th of January. I think we had over 300 persons recovering on the 20th of January. So we are doing quite a good job in terms of containing this fourth wave of COVID-19 infections. In this time period, we've added 2,509 cases, and a total of 1,973 persons have recovered fully. Now, in terms of active cases, we are monitoring 553 such cases. Our case managers, we want to commend them for the work they're doing. They are monitoring the cases around the clock. And within the 3 days, we've had 5 COVID-19 related deaths. So between Sunday to Tuesday of this week, we've had 5 persons dying of COVID-19. Now these individuals are elderly, they were older adults with underlying chronic conditions, and they were all unvaccinated. Now this picture shows the waves beating on our black rocks, and it also highlights the 4 waves that we've been experiencing. The first wave in 2020, we added 45 cases. The second wave between May to July 2021, we added 499 cases to our COVID-19 tally. In the third wave, we added 2,098 cases. In this wave, the fourth wave, So far, we've added 2,509 cases. Again, I wanted to just, underscore that, these relate 5 deaths that we've had. 1 documented in Nevis, 4 St. Kitts. They were all unvaccinated. They were all older adults between the age of 68 to 92 years. They all had underlying chronic medical conditions. This slide provides us a snapshot as to the current COVID-19 situation. To date, we've recorded 5,331 confirmed cases of COVID-19, with 792 in Nevis, 4,536 St. Kitts. Again, as I mentioned earlier, the trend continues whereby the patients are recovering nicely. To date, we've had 4,745 persons recovering. We are now monitoring 553 active cases, with 98 on the island of Nevis, 455 on the island of St. Kitts. To date, we've only recorded 33 COVID-19 related deaths, 6 for Nevis and a total of 27 for St. Kitts. I want to bring to your attention just some additional information with respect to the 33 COVID-19 related deaths. In terms of gender breakdown, 2/3 of the cases were male and 1/3 female. And this is in keeping with the global international trend whereby the males tend to die more so of COVID-19 versus females. The scientists, they are looking into this as to, what are the factors. It's somewhat complicated, and we are still awaiting this information. They are trying to unpack the reason why males tend to die more so from COVID versus females. 29 or 88% of the deaths were unvaccinated. And the deaths, they were mainly older adults between the ages of 40 to 60 plus. So again, gender, your vaccination status, age, and the presence of underlying chronic conditions place you at risk for severe COVID, hospitalization, and even death. And so we want to reach out to those individuals who are unvaccinated, those, especially the older adults with underlying chronic conditions. We are, pleading with you to come on board and give yourself that additional layer of protection against severe disease from COVID, even hospitalization. The Omicron variant is the predominant variant in circulation. The Lambda variant was in circulation between May to December of last year. The Omicron variant is causing a more milder form of disease. However, I want us not to become nonchalant and take it for granted, because in 3 days we've had 5 deaths. And so it is still significant, and we want persons to adhere to the COVID-19 prevention and control measures. And we want those who are unvaccinated to come on board in terms of receiving or consenting to the vaccine. Could you go back one slide? A very important slide. It shows Dr. Rafael Rosales, our national epidemiologist, and Ms. Akila Moore, the statistician within the Ministry of Health. I want to pause and thank them both for their hard work and for their contribution to the weekly presentations in terms of the situation report. And so thank you, Dr. Rafael Rosales and Ms. Akila Moore. This is a picture taken this morning as we were working on this presentation. Now, in terms of the COVID-19 vaccines, persons are saying, hey, why do I need to take the vaccine? Because persons who are vaccinated are still experiencing breakthrough infections. But what's the real deal? The vaccine, the COVID-19 vaccine, still provides you a level of protection against COVID-19 infections. There are persons who have been exposed to Omicron and they didn't pick it up because they've been fully vaccinated, they've gotten their primary series, and more so those who got their booster shots. No, they didn't pick it up, or if they did, no symptoms whatsoever. So the vaccines provides a layer of protection against COVID-19 infections. It also reduces the risk of severe illness and death amongst persons who are fully vaccinated. The literature suggests and recommends that the vaccine effectiveness against hospitalizations has remained relatively high over time. Now, in terms of some recent information coming out of CDC, the research show that children who have recovered from COVID-19 appear to be at significantly increased risk of developing type 1 or type 2 diabetes. And this is information, new information coming out of CDC. So they looked at two cohorts of children, and in one cohort, they found a 2.6-fold increase in risk in developing diabetes post-COVID, and in the other cohort, a smaller 30% increase in risk in developing diabetes post-COVID. And these are children under the age of 18. Now, this bit of information provides additional reasons and underscores the importance of providing consent for children who are eligible for vaccination to be vaccinated. The studies also show that there is a heightened risk of developing diabetes in adults who have recovered from COVID. So in other words, in short, or in summary, the diagnosis of COVID-19 in adults seems to give you or provide or add an additional risk of your developing diabetes, and also in children. So this is one additional reason for individuals to come on board in terms of saying yes to the vaccine that provides you a layer of protection against this disease. Ladies and gentlemen, let's all remember the protective measures that have kept us over this past 2 years, the vaccination, the wearing of the face mask when in public places, maintaining adequate hand hygiene, and appropriate distance between ourselves and others when in public. And each week I keep repeating, if you are experiencing any of the COVID-like symptoms, we want you to remain at home and not expose others to the virus. Between the 1st of January to present, the last slide, we've been enjoying some beautiful sunsets here in St. Kitts and Nevis, and I'm sharing with you a picture of the sunset taken on Sunday evening, January the 23rd. Thank you.
Thank you very much, Dr. Laws. I now invite our Superintendent of Police, Mr. Cromwell Henry, to give us his presentation.
Thank you very much, Mr. Williams, and a pleasant good afternoon to all. We are still monitoring the new COVID-19 infections, and we are encouraged by the numbers which continue to trend downwards. The freeze on permissions to host social events and other mass gatherings is still in effect and likely to be until around the end of this month. We therefore ask for your patience and cooperation until such time. We remind bar owners and entertainers that permission is required to play hi-fi music in public places. Section 56 of the Small Charges Act provides as follows. No person shall, except during carnival, without license from the police, play any noisy instrument in any street or public place. A person who contravenes this provision shall be liable to a fine not exceeding $5,000 or to imprisonment for a term not exceeding 1 year. Bars and restaurants are permitted to conduct their normal business operations. However, owners must ensure that patrons and staff adhere to the COVID-19 protocols. They must observe social and physical distancing protocols while at the establishment, practice good hand hygiene and other sanitization behavior, and wear a face mask, except, of course, while eating or drinking. As we strive towards the resumption of social activities, other social activities that is, we ask for your continued cooperation so that the new COVID-19 cases continue to trend downwards. Thank you.
Thank you, Superintendent. That was very brief indeed. I would like now to invite Mr. Abdias Samuel, the chair of our National COVID-19 Task Force and National Disaster Coordinator at NEMA, to give us his presentation.
Pleasant good afternoon, Mr. Williams and all those who are joining us via all the various means. Thank you for being here with us again one more week. And we hope that you could continue until we reach the end of this pandemic and crisis. This week I want to address just a few things. The National COVID-19 Task Force would have met yesterday and we would have discussed a number of matters. And I am happy to hear Superintendent Henry speak to the regulations and also speak to the downward trend in cases and the positive outlook in terms of the resumption of social activities and other social activities as well, besides just entertainment. And I will speak to that in a bit in my presentation. I'm also happy to see that Dr. Lars would have shared with us the sunshine, and I am certain the message behind that is that the light is at the end of the tunnel, and we should be looking to some lovely times ahead. Correct, Dr. Lars? Wonderful. I just assumed, yeah? Right, Dr. Wilkinson? Right, correct. Right, so I think we need to feel happy, and I want to pause and commend the population of St. Kitts and Nevis, our citizens, residents, visitors, everyone who has entered our shores during these difficult times, and everyone who has endured during these difficult times. I think the perspective and the forecast and the trajectory that we are seeing seems positive at the time. We have done a great job together, collaboratively, in managing this wave, and I want you to rest assured that we will continue to work to ensure that St. Kitts Nevis moves in the right direction. However, in order for us to do that, we have to continue with the non-pharmaceutical measures. I have been contacted by a number of business owners questioning about the protocols, for example, the distancing. They have been asking about the temperature checks and the bookkeeping, meaning the recording of names, etc. And for now, we want you to continue. We want to encourage you to continue for now. And we every week, we are reviewing the protocols. We are looking at the numbers, and we are looking at how we can ease a number of the restrictions going forward. So that is being taken into consideration, bearing in mind that even within the task force itself, you have a number of members who are very social. Even, I have my good friend here to my left. He loves it. He loves his karaoke, so I know he wants to return to that. And also, the good doc has been rather precise, but I think it's time, he wants to have some flexibility, yes? So I want the general public to understand that we are getting there. So the Ministry of Education would have resumed in-person learning schooling the 24th, which would have been last Monday. By next week, we want to review and see what the impact has been for our students to return to in-class learning, in-person learning in the schools. And that is something of urgent matter for us. We want to give it a lot of attention to make sure that there is no significant impact to our students. And with that said, please, if you are over the age of 12, encourage yourself, encourage your children, teach them about the vaccine, and take them to get vaccinated and protect them. We are hoping that by next week we will meet with the officials from the Ministry of Education so that they can give us the perspective, the challenges, the concerns that they have, as well as give us whatever progress they have seen in having the children back in the classroom. I am happy because it was not easy, to see some of the challenges, especially psychosocial impact it's having on children. So I'm happy that this has taken place. Equally so, let me bring it to the tourism aspect of things. I have been receiving a lot of calls, some people have come rather aggressively in terms of the cruise ships and the cruise ship cancellations, etc. Let me just say, the task force has not cancelled any ships from coming here. And yesterday we would have had an extensive discussion in this regard because we have been strong advocates, supporters, facilitators of ensuring that our economy remains vibrant, and also we can get people back to work, and we can get our economy to that competitive level, regionally, internationally, but most importantly, nationally. So what happens? Even before pre-COVID situation, as reported by Public Health, ships have to give their maritime declaration forms. They have to do this, I think, 24, 48 hours before they come into the port, next port. And if they meet the criteria, regulations for the particular port that they are going to, then they will be granted pratique, meaning that yes, they can dock and they can disembark, etc. Now, if they don't meet that and there's a concern, then they will not be granted pratique. Not being granted pratique means that they will not be able to dock at our ports and disembark, etc. St. Kitts Nevis, as adopted by our Federal Cabinet of Ministers, has a threshold of a 1% positivity rate on the ship. With that 1% positivity rate, if the ship does not meet that 1% positivity rate, then that means the ship may not be able to dock. And I say may not be able to dock. However, if they are under the 1%, then, and they meet the other criteria in the Maritime Declaration, then the ships will be allowed to dock in the Federation of St. Kitts and Nevis. Yesterday in our reports by Public Health, I was rather pleased, and this goes to all the persons in the tourism sector, whereby, with your permission, CMO, the CMO would have reported that, and also Dr. Wilkinson, that a level of flexibility is taken whereby a risk analysis is done of the Maritime Declaration that is submitted prior to the ship arriving in our waters, and we have gone as far as flexing to a 1.7% positivity rate on ship. So what that means is that we have actually given a 0.7% increase in the scale that our regulations basically outlines. So flexibility has been happening, and that is why you see that I am happy that the CMO made that report yesterday to the task force in terms of the ships and the cancellation of some of these ships. So what will happen, based on what we were informed, that some of these ships may have a 4 or 5% positivity rate on the ship. So therefore, they themselves will take the position of not coming to our ports, or our port here in St. Kitts and Nevis to dock, because they realize they already gone way beyond the threshold. And the fact that we have been flexible in having that range between 1 and 1.7, I think is rather commendable and is important for you, the general public, and in particular those in the tourism sector, to know the flexibility that has been happening. So the way forward now, what do you expect? Where do we want to go? We have been discussing in terms of increasing the threshold. I cannot say to what number because that has to take another round of discussions, and then this has to be taken to cabinet. And the federal cabinet will determine whether we are at a stage where we can absorb that particular risk in the country by increasing the threshold of the positivity rate percentage in St. Kitts and Nevis. It is our understanding when we engage about what is happening in the region, in particular in the other OECS countries, we also learned that Bahamas, in particular, talking about the English speaking, Bahamas has a 2% threshold. So some research is going to be done to see what has been the impact of having a 2% threshold in your country. So with that, we are hopeful that by the time the medical team comes back with that data, we can then deliberate and make a recommendation to the cabinet to increase the threshold or to remain, or for the threshold to remain as it is based on the risk assessment and analysis that will be done. So I hope that has brought some attention to those in the tourism sector who thinks that is a thing that, just the information comes, task force or anybody says, no, the ship is not coming in. It doesn't work that way. It's a very comprehensive process led by our chief medical officer and supported by all members of the task force and the medical team as well, the HEOC, in terms of how the process goes. So it's just not a nilly-willy process. No, don't come, because it impacts everything that we do here in St. Kitts and Nevis in terms of the cruise industry. So I'm hoping that this will bring some light to the cruise ship matter. I also want to raise with you, while we are the tourism subject, the air traffic into St. Kitts and Nevis. So we have made some adjustments, as I said before, and I will say it again. We have made some significant adjustment to our entry process, and not the protocols, but the entry process itself. And we are providing you with more guidance in the event that you find yourself in a situation where your flight has been cancelled. You will see in the letter that you receive, it will say basically what to do if your flight has been cancelled. We have been experiencing a number of cancellation by some of our major airlines into St. Kitts and Nevis, and once that happens, please use the contact information that is provided to you, and everything will be done to facilitate you, as we need to get our citizens, residents, and even our visitors into St. Kitts and Nevis. Now, as it regards to stayover passengers, I have been in discussion with the hotel operators for the past week in terms of the impact that the Omicron has had on them. The majority of the impact has been on the workforce, having a significant reduction in the number of persons that are impacted or come out to work. And with that said, they have had to balance, and they have done a great job in terms of balancing, and also trying to encourage persons to vaccinate, because if you're vaccinated, you recover quickly and you can return to work much more quickly. And also, we have also seen, based on the reports from them, the impact that the classification CDC has labeled St. Kitts as a Category 4 country has also had in terms of those groups that are coming to St. Kitts and Nevis. So, however, for now, what is positive for us is that we have not seen, according to the reports from those service providers, that the groups are cancelling. That is welcoming information. We are hopeful that we can continue to have these groups having confidence in our destination, and we hope that as the numbers go down, the CDC can be so kind to consider St. Kitts and Nevis and reduce the classification of St. Kitts and Nevis as a level 4 and reduce that level to a more welcoming level. I also want to touch another sector which was critical for us yesterday. We engaged yesterday with a number of sporting entities. One such sporting entities yesterday that we spoke with was with the St. Kitts Nevis Football Association. And I must report to you that we were quite pleased in terms of the grassroots league, the youth league, as well as the female team. I think the female, they must be commended, where they have reached a threshold of over 65% of them being fully vaccinated. We know that they have gone overseas and we have given them their support, the necessary support. They have gone overseas to represent the federation and they have been doing well, and we must commend them and we will continue to support them, and we are hopeful that we can get them playing football in a competitive manner very soon. My understanding is that they should be practicing. However, the competitive part of it, very soon we should have that in order for them. The youth league and the grassroots league, we are satisfied by what has been presented. We are hopeful that as soon as we take this to cabinet, we can have a favorable outcome for the football fraternity. Now, the biggest discussion is the senior league, and we have been open to reduce it, looking at the threshold that has been set before, and we are quite satisfied that that can be reviewed, and we need to have football, and we all agreed that we will do our best to facilitate the resumption of the senior league as soon as possible. We are not here to impede or try to stop the league from starting. That is not our focus. Our focus has always been how we can resume all sectors in a safe manner. So I want to put that out there. The president would have bring a delegation of himself and 2 other persons to present to the task force, and we were rather satisfied with what has been presented. They have been given some guidance for them to go and do some more work. I must say to you that we have facilitated a number of international matches with the previous members of the executive, Mr. Jacob and the team. So protocols are already there. So this association basically just need to package and bring it forward so that we can get the footballers playing. As I said before, football is a religion here in St. Kitts and Nevis, and we need to get this sporting activity going. And I want to take this opportunity to make an appeal to all sectors of the sporting community to bring your proposal forward, engage. If not, I will be reaching out to you very, very soon to give you some guidance in terms of the protocols and how we can resume all these sporting activities as soon as possible. We also reviewed the drag racing in Nevis as a proposal was submitted, and this proposal was met with welcoming and satisfactory protocols and guidelines as outlined by the submission, and we will now be taking this to cabinet hopefully by tomorrow morning, where we will meet at the cabinet and make the presentation to get cabinet's blessings and then communicate to the Drag Racing Association and Nevis. To the DJs playing at bars, the entertainers, we have you under the radar to work with you as soon as possible as we continue to have control over this outbreak. And we are hopeful that we can meet and engage and consult and use the previous information that we have collected from you to hopefully open up this sector as soon as possible and have it functioning in a safe manner. However, I want to solicit the cooperation of all with the compliance officers and the Royal St. Christopher and Nevis Police Force as they are doing their best to ensure that we have a safe environment. So please have some more patience. We are going to get back to you as soon as possible. It's on the agenda item for our next meeting to discuss the entertainment sector to comprehensively and to see how soon we can get you up and running. Mr. Williams, I know I'm not as brief as Mr. Henry, but I want to also use this opportunity to promote the St. Kitts and Nevis Population and Housing Census 2021-2022. The Population Housing Census is planned and performed by the Department of Statistics, and it is my understanding that they are getting ready to roll out this program. They will be meeting with the National COVID-19 Task Force in terms of protocols of engagement during the context of COVID-19, and we are hopeful that you, as well as us, can give them the necessary support so that we can have this activity become a success. So please support the St. Kitts and Nevis Population and Housing Census 2021-2022, and let's get ready to give your full participation and cooperation to this census. Thank you very much, and we look forward to your questions.
Thank you very much, Mr. Samuel. We'll start the ball rolling with the questions. The first two are related, so I would ask them. Is it recommended that children be in air-conditioned classrooms with masks at this time? And should children be in air-conditioned classrooms without masks during break times or lunch times if there are no windows and doors opened?
The risk of COVID spread is greater if you are in an enclosed setting that is poorly ventilated. If you are in an open space, the risk is less. And the reason why it is greater in an enclosed setting that is poorly ventilated, if you are speaking, especially without a mask, you can have the aerosols that are released and they can stay suspended for quite some time. Now, most air conditioning units are designed to cool the air and not necessarily recycle the air, bringing in fresh air. And so most of the wall units that we have, I'm not an air conditioning expert, but I know they tend to cool the air. And so if you're going to be in an enclosed setting for a long time with a wall unit, it is good if ever so often, probably once an hour or two, you open the door to let fresh air in. There are some settings where one has to have air conditioning because you would not have enough cooling effect, and persons can get overheated. And so I'm not saying that one is not supposed to use an air conditioning unit in this context of COVID, but persons should be wearing their masks. They should be trying to stay as spaced apart as possible and make every effort to bring fresh air in from time to time.
Can the health officials say how many children were impacted or have been impacted thus far during the fourth wave? And can the health officials also say what is the cost for treatment per patient? This question is from SK and Vibes.
I don't have the exact figures, but we know that no age group has been immune. We have had children admitted during this wave with COVID-19, and that's one of the reasons why we ask persons, if you are a parent, if you are an adult or a guardian looking after someone who is between the age of 12 to 17, you need to make sure that these persons come forward and get vaccinated. For those below the age of 12 who right now cannot be vaccinated, we all need to be our brother's keeper and go forward and help to protect them. We had given the figures before about the cost per day for caring for persons at the hospital. I can't remember the figure off the top of my head, but it's several $1,000s.
What is pityriasis rosea? What are its symptoms? What is the treatment for it? And how is it related with COVID-19?
I'm not going to come here on the spur of the moment and pretend to be an expert on every single thing. Pityriasis rosea is a skin condition. The details I can't give you right now, and I don't know of any relationship to COVID-19. But it's something that whoever is asking, you can easily go on Google and find out also.
The children 4 years and under have to take a PCR test to leave and return to the Federation.
Okay, our protocol state that if you are coming into the Federation, we want you to provide us a negative RT-PCR test done within 72 hours prior to coming in. And so yes, children under 4, they have provided us with our negative RT-PCR tests. However, young children, like those, newborns, etc., they are unable to ascertain COVID-19 testing in some U.S. states. And so we've granted them permission to come in under the cover of the appearance, mother, father, who come in with negative tests. And then when they come in, we monitor them. So children are expected to provide us a negative RT-PCR test. However, the young children, if they are unable to provide same, they can come in under the cover of the appearance. In terms of persons leaving the Federation, we don't have a requirement for children to be tested prior to departure. However, if the country where the child is going requires a test, they'll have to have that pre-departure test.
Persons infected with COVID-19 are asked to isolate at home with no security present. Why then do returning national in quarantine have to pay for security if they quarantine at their homes?
I think I answered that question last week. The answer is simple. The regulation requires it, and so we just have to do what the regulation requires.
Just to follow up on the question about the cost of care, the cost per day per patient is estimated to be about $5,521.83. Patients usually stay between 5 to 16 days, and this cost include the staff salary, IV drugs that sometimes run about $800 per day, the hospital room $350, the personal protective wear, which is about $275 per day, and the COVID testing. And so per day, if someone stays 10 days in the hospital, 10 times 5,000, what's that, 50,000? Okay, but the vaccine is free, and it significantly reduces your risk of hospitalization. And so one should do the math. I see Mr. Samuel smiling with the math I'm giving here. Okay, so you can choose to have a vaccine that is free, that will protect you from the severe disease, hospitalization, and death. Or you can stay unprotected. You come to the hospital, you will have significant cost, and you can still live with long-haul COVID. And you heard the CMO spoke about even the risk of developing diabetes after COVID-19. So this, again, overemphasizes the importance of vaccination, which we've been preaching for almost a year now.
Right, and you didn't include the funeral cost. Thank you very much for asking your questions, sending in your questions today, and I hope that they were adequately answered. Of course, your questions and our response, this is all a part of the management of the COVID-19 pandemic. Thank you very much. I want to thank all of our presenters today, Dr. Wilkinson, Dr. Laws, Superintendent Henry, Mr. Samuel, and we thank Mrs. Christmas Jacobs for her service of sign language. We thank Michelle Rodriguez, the PRO at NEMA, ZIZ, and all media houses, and Dr. Marisa Carty, all media houses for partnering with us in the management of the COVID-19 pandemic. We thank the Honorable Wendy Phipps, of course, always for her support here at the New York. Thank you very much. We will be back next week with another NEOC briefing. Until then, take good care. Continue to abide by the protocols. I am Les Roy Williams.
There you had it, folks, another edition of the COVID-19 briefing here on WINNFM 98.9. Up next, we got the WINNFM News and Sports package.